Good morning. So what is social media and why should we care as plastic surgeons? Well, social media is now the #1 way that we search for information online. The days of direct referrals from physician to physician without patients doing their own homework are over, and there are so many online resources, both good and bad. Plastic surgery is very social. We now have the selfie generation, and I'm one of them. Celebrities have really introduced plastic surgery to the masses. There are plastic surgery review sites like Real Self where patients go and post their own photos. A couple years ago, we had the Angelina effect where she came out of the closet and talked about her BRCA gene. And this past year, we had the first penis transplant, and that really garnered international attention. So how can we use social media to help our practices? Well, patients are looking for information about plastic surgery procedures online. They're checking out all their options, and they're also researching you. Social media is a way that you can control the message that patients receive about the procedures and also about you. And I really view social media as a virtual office. And it's also an online encyclopedia about who I am, what procedures I do, and you can control the message. A paper came out in PRS earlier this year by Olivier Branford, who is known as the #plastic surgery, #Twitter king. He has over 100,000 Twitter followers. And this paper was mostly about Twitter, but he was saying that social media can be used for professional networking, for connecting with a potential patient base, impacting the academic community, engaging and educating the public, and then promoting quality and safety in our profession. The social media sites that I use professionally are mostly Twitter, Facebook, and Instagram. I'm now at 25,000 Twitter followers, and what does that get me? Not a lot. I do it just because it's kind of fun. I don't get a lot of patients from it, but it's a really good way to put a message out there and be more visible. What I'm not using on social media, Pinterest. A lot of patients will have Pinterest boards when they're looking for images for breast augmentation. I don't personally use that site. Once in a while, I'll turn to it for an inspiration for, a blog post, featured image, that type of thing. Snapchat, I'm not on at all, and I would be interested to learn from any surgeons if they are on Snapchat, using it professionally. I'm not on Google+. You really can't do everything, and remember, you're a plastic surgeon first. So how do I use social media in my practice? Well, patient education is #1. You can comment on and be part of current events like this meeting, Bra Day. I use it to build and tailor my brand. We really all have a brand. I use it to grow my practice and to connect with other like-minded people out there, not just doctors and patients. And then lastly, practice promotion when there's special events. Your website is really considered social media as well because first impressions are everything. Most patients will find you online, they'll find your website, and your website is a really good way for you to control the message, build your brand, because you have 100% control over what you put out there. So I want to mention hashtags. I didn't even know what a hashtag was about a year ago, and Olivier asked me to start using #plastic surgery. He was doing a study about it. It's essentially the pound sign. But the purpose of using a hashtag is it makes your content discoverable by others. So there was a campaign by ASPS, #DoYourHomework, in terms of finding a board-certified plastic surgeon. A lot of the breast reconstruction community will use #breast reconstruction and some of the other procedures because that's what patients are looking for. When you use hashtags, you want to be specific. So at this meeting, if you are taking pictures, selfies, fun things, images of slides, if you're putting them on social media, use the hashtag #AtlantaBreastMeeting because other members can look for it. You can share posts and you can see what people are saying about this meeting. You want to be specific to the social network that you're using, and you want to use relevant unbranded hashtags. And a general rule of thumb is only use 3 hashtags per post. So what do you post on social media? Well, it's not all about you. And when you're putting stuff out there, try to limit your posts 1 in 5 to self-promotion. You can post patient stories, their journeys, but be really important to follow HIPAA guidelines. You can have examples of how you're a skilled surgeon, how you're a caring person, things that you do in your private life. And it can really humanize the profession, it can humanize you, and to give patients an idea of who you are as a person. You want to stay lighthearted, you want to stay professional. When you're creating content for your social media, you can start by following other people that you admire or respect and like their posts, share their posts. You can take videos, and we've seen lots of videos in the operating room today. Just, if you are taking a video, make sure that you edit it and review it before you post it. What to avoid posting? Well, nude images, nipples and pubic hair are not appreciated online, and your post will get flagged and taken down. And be mindful that a lot of your followers on social media are not going to be medical, so they could find your posts of surgery disgusting. And your post will be flagged and deleted by some of the social media companies. And if you've had enough posts that get removed, your account could be suspended and shut down. There is one surgeon who's very popular on Snapchat. He apparently takes 4 hours to do a breast augmentation, and he Snapchats every single surgery. My question is, who's paying for the extra OR time? Is there explicit patient consent? Each one of his posts gets 1.7 million views. So he's using it effectively. Apparently he's booked out for 3 years, somebody told me recently. So he's used it to his benefit, but the question is this responsible? And how can we learn from a surgeon like this and use it in an educational way? Online patient reviews are a reality, and this is often after patients find you, they will do a search and look for your online reviews. They're doing their due diligence, and they're checking out your reputation, your bedside manner, your office environment, what are people saying about you? And unfortunately, the number of stars does matter. Online reviews can sway patient perception of doctors, and interestingly, the most used sites are the patient-driven sites. They're not the sites where there's actual real information. But I always say, don't despair, the truth usually comes out. Google reviews are everywhere, and if you haven't, Google yourself and type in your name and Google reviews, because you're not notified about these reviews. Yelp is very popular in San Francisco. Unfortunately, once your business is reviewed, you cannot take your site down, and anyone can say anything about you based on their subjective experience. Often the most descriptive or dramatic reviews get the highest ranking, and Yelp decides which reviews to highlight. There's really no way to tell whether a reviewer is telling the truth or not. So you can ask patients to review you, but make sure that they've reviewed other businesses first. And beware of your colleagues who have all 5-star reviews, because you can purchase this through advertising with Yelp. How I approach online review sites: we're all human. When you get a negative review, we do take it personally. Try to focus on the positive reviews and try to cultivate new reviews. How do you do this? Well, you ask for them. There are different ways you can ask your patients to review you online. We send out an email to patients that we finished treating, we know that they're happy, with a link to all the different review sites. How do you handle problem patients? Well, if you're being harassed, you can block them. If you are going to respond to a review, take time, don't do it emotionally. Always take the high road, and understand that sometimes patients feel threatened, and this is really their only recourse. So keys to success: follow HIPAA guidelines, have a strong educational content, be honest, kind, authentic, and professional, allow your personality to shine through, avoid answering medical questions, and don't friend your patients routinely. Understand that your voice is very powerful, and you do have a great responsibility. And if you don't have anything nice to say, remember that. Don't drink and post. And remember that everything online is permanent, even if you think it's gone. So thank you very much. One other thing, try to use a consistent handle on every single one of your posts. So I use @Dr. Karen Horton. Just be consistent along all the venues. Thank you.